All, let's see the external carotid artery. This external carotid artery, it is one of the terminal branch of the common carotid artery, which extends from the upper border of the thyroid cartilage to the just behind the neck of the mandible. And just behind the neck of the mandible, this external carotid artery is divided into two branches, the maxillary arteries and the superficial temporal artery. At the site of the origin, this external carotid artery, it lies anteromedial to this internal carotid artery. When this external carotid artery passes upward, it is going to be overlapped by the posterior belly of the digastric muscle and stylohyoid muscle. From here, when the artery inclines upward, it is going to pass through the substance of the parotid gland, within which it is going to divide into two terminal branches. So when we see the superficial relations of this external carotid artery in the carotid triangle, it is going to be overlapped by a large muscle of the neck, and that is the sternocleidomastoid. And under the sternocleidomastoid, we can find this posterior belly of the digastric stylohyoid muscle as the superficial relation of this external carotid artery. Along with this, the two important nerves are also related superficially to this external carotid artery, and one of them, it is the hypoglossal nerve, and the other one is the lingual nerve. As it passes upward, it is going to pass through the substance of the parotid gland. So this part of the parotid gland, it is also superficial to the external carotid artery. Within the parotid gland, it is superficially related to the retromandibular vein as well as the facial nerve. So when we see the deep relations of this external carotid artery, the constrictor muscles of the pharynx, they lie deep to this artery. Along with this, the few other structures are also passing deep to the external carotid artery, and this structure lies between the internal carotid artery and external carotid artery. When we see the deep relation of this external carotid artery, few of the structures, they are passing between the external carotid artery as well as the internal carotid artery, and between these two structures mainly the styloid process lies, and from the styloid process two muscles are going to pass, and these two muscles, these are the styloglossus muscle and other muscle, that is the stylopharyngeus muscle. And along with this, the glossopharyngeal nerve also passes between this external and internal carotid artery and going to supply the styloglossus as well as the other structures of the pharynx. And as we already know, this external carotid artery is going to bifurcate within the substance of the parotid gland. So the deep part of the parotid gland also lies between this external carotid artery as well as the internal carotid artery. So all these are the deep relations of the external carotid artery. Now let's see the branches of this external carotid artery. This external carotid artery, it passes upward and going to divide into two terminal branches just behind the neck of the mandible into the maxillary artery and superficial temporal artery. One branch from the medial aspect of this external carotid artery that passes upward and going to supply the pharynx, and this branch, it is called as ascending pharyngeal artery. Three branches are going to arise from the anterior aspect of this external carotid artery, and one of them is the superior thyroid artery, which is going to arise just below the level of the hyoid bone. Second branch from the anterior aspect of the external carotid artery, it is the lingual artery, which is going to arise at the level of the hyoid bone. And the third branch from the anterior aspect of this external carotid artery, which is going to arise from just above the hyoid bone, and this artery, it is the facial artery. Two branches are going to arise from the posterior aspect of this external carotid artery, and one of them is going to arise from the level of the facial artery, and this artery, it is the occipital artery. And the other branch arising from the posterior aspect of the external carotid artery just above the occipital artery, and this artery, it is the posterior auricular artery. So this external carotid artery gives off branches. The first one, it is the ascending pharyngeal artery. Three branches from the anterior side of the artery. These are the superior thyroid artery, lingual artery, and facial artery. And two branches from the posterior aspect of this external carotid artery. These are the occipital artery and posterior auricular artery, and two terminal branches of the external carotid artery. These are the maxillary artery and superficial temporal artery. So there are 8 number of the branches going to arise from the external carotid artery. Now let's see the detailed branches of all the branches of this external carotid artery one by one. Now let's see the ascending pharyngeal artery. This ascending pharyngeal artery, it is the smallest branch of the external carotid artery which passes from the medial aspect of the external carotid artery, and this artery passes upward between the wall of the pharynx and the internal carotid artery. This ascending pharyngeal artery gives up three types of the branches. First type of the branches, these are the pharyngeal branches, and these pharyngeal branches, they are going to supply the wall of the pharynx. Along with the wall of the pharynx, it will also supply the soft palate, tonsil, as well as the auditory tube. The other type of the branches, these are the tympanic branch, and this tympanic branch, it is going to enter within the middle ear cavity to supply the middle ear cavity along with a few other tympanic branches. And the third type of the branches from this ascending pharyngeal artery, these are the meningeal branches. These meningeal branches, they are going to enter within the cranial cavity through the foramen lacerum, jugular foramen, as well as the hypoglossal canal. So these are the three branches from the ascending pharyngeal artery. Now let's see the superior thyroid artery. The superior thyroid artery, it is going to arise from the anterior aspect of this external carotid artery just below the greater cornea of the hyoid bone. And this artery passes downward and forward and reach up to the upper border of this thyroid gland, and at the upper border of this thyroid gland, it is going to divide into two terminal branches. One passes anteriorly, that is anterior branch, and one passes posteriorly, that is the posterior branch of the thyroid artery. The superior thyroid artery, it lies on the inferior constrictor muscle, and it is closely related to the external laryngeal nerve which lies posteromedial to it. Just at the upper border of the thyroid gland, this nerve deviates from the superior thyroid artery and passes deep to the gland. That's why at the time of the thyroidectomy, the superior thyroid artery should be ligated as near to the gland as possible, because at this site the external laryngeal nerve lies slightly away from this artery, and therefore the chances to the injury to this external laryngeal nerve along with the ligation of the superior thyroid artery is very rare. The superior thyroid artery gives 5 branches, and the first branch that passes below the hyoid bone and which is going to anastomose with the opposite fellow of the same artery, and this artery, it is called as the infrahyoid artery. The another branch from this external laryngeal artery, it passes downward and reach up to the cricothyroid membrane, and this branch, it is the cricothyroid artery, which is also going to anastomose with the same branch of the opposite side. One branch of this superior thyroid artery, it passes downward and reach up to the sternocleidomastoid muscle to supply it, and that branch, it is called as the sternocleidomastoid branch. One more branch from this superior thyroid artery, that is the superior laryngeal branch, and this superior laryngeal branch, it it is going to pierce this thyroid membrane to enter into the laryngeal cavity along with the branch from this external laryngeal nerve, that is the internal laryngeal nerve. And this artery, it is going to supply the interior of the larynx. And the two terminal branches, they are the glandular branches. These are the anterior branch and posterior branch we have already discussed. This anterior branch, which is going to anasmos with the same anterior branch of the opposite phyllo just above the isthmus of the thyroid gland, while this posterior branch, it is going to anasmos with the branch of the inferior thyroid artery, which is actually a branch of the thyrocervical trunk of the subclavian artery. And sometimes the lateral branches also there from this terminal portion of this superior thyroid artery to supply the lateral aspect of the gland. So this is the superior thyroid artery along with its branches. Now let's see the lingual artery. This lingual artery, it is going to arise from the anterior aspect of this external carotid artery just at the level of the hyoid bone. Sometimes this lingual artery, it is going to arise from a common trunk from the external carotid artery, which will divide into the facial artery and lingual artery, and this common trunk, it is called as linguofacial trunk. This lingual artery itself is going to divide into three parts by the hyoglossus muscle, and the first part of the lingual artery having a convexity upward, and it will reach up to the posterior border of the, and the second part of this lingual artery, it passes deep to this hyoglossus muscle and it lies just above the hyoid bone. And the third part of this lingual artery, after coming out from the anterior border of the hyoglossus muscle and reach up to the tip of the tongue, where it is going to anasmos with the opposite fellow of the same artery. And out of these three branches, the third part is also called as arteria profunda lingually, and this is the deep lingual artery. This lingual artery provides three sets of the branches, and the first one is the suprahyoid branch, which is from the first part of this lingual artery, which is reach up to the midline and get anasmos with the opposite fellow of the same artery. The second set of the arteries, they are from the second part of the lingual arteries, and these arteries, they are passes upward, and they are 3 or 4 in number, and they are going to supply the dorsum of the tongue as well as the tonsil as well as the soft palate. And these branches are called as the dorsal lingual arteries. And from this third part of the lingual artery, that is the arteria profunda lingually, provide one sublingual branch, and this sublingual branch, which will going to supply the sublingual gland as well as the floor of the mouth, and going to anasmos with the sublingual branch of the opposite lingual artery. The second and the third part of the lingual artery, we can expose this in the dissection of the submandibular region. At the time of the surgical removal of the tongue, mostly in case of the carcinoma of the tongue, the first part of the lingual artery should be ligated before it gives any branch to prevent the excessive bleeding. So this is all about the lingual artery.